Hi, I'm Dr. Dani. This is the first video of my series on IBS, and it starts with a bang, giving you 7 easy steps to cure IBS without drugs. IBS is a chronic condition which very few conventional healthcare practitioners know how to treat effectively, but it can be very simply and effectively managed and even cured in some people with just a few simple steps. So let's jump straight into them. Number 1 is cut out dairy and lactose. Lactose is a type of sugar that's in dairy products. It's in milk, ice cream, and yogurt, as well as in many packaged foods, like baked goods, for example. So check the ingredients lists. Lactose is hard for some people's digestive tracts to process, and it leads to lots of bloating and gas. Cow's milk, cow's yogurt, and cow's milk cheeses are the worst culprits, i.e. they have the most lactose compared to goat's milk and goat's yogurt and goat's cheeses. They have less lactose than cow's milk's dairy. So if you're really a cheese or a dairy addict, even just switching to goat's milk dairy products can make you have less bloating, less pain, and less gas by just avoiding the cow's milk dairy. Even if you've been tested for lactose intolerance and you've been in the clear, dairy can still be a trigger for your IBS symptoms. Because some people can actually develop a type of allergy or intolerance to dairy. One of my recent IBS patients had almost complete resolution of her symptoms just from doing this one thing alone. And for the first time in over 15 years, she had a flat tummy and she felt great wearing a tight dress without being embarrassed by her bloating belly from her IBS. Number 2 is find your food triggers. Many top studies on IBS now recognize that the huge role food plays in IBS. Some foods are triggers because they were irritating to the lining of your gut or digestive tract, like spicy foods, whereas other products or foods produce lots of intestinal gas, like some forms of sugars and veggies. And other foods all cause IBS symptoms by causing a type of gut allergy or intolerance, like we just mentioned earlier. It's very important to discover what foods, what drinks, and what substances that pass your lips are causing your symptoms to flare, so you can take control over your IBS and you can understand your body better. Number 3 is keep a food diary. Keeping a food diary is the best and most surefire way of figuring out what foods, drinks, and other stuff you're putting into your body, like cigarettes and alcohol, are causing IBS symptoms for you. You should keep this food diary for 2 weeks, so that you can see clear patterns. And you also want to record when you have symptoms so you can go back and see what foods are causing you to have problems within a few hours of eating or drinking them. I also strongly recommend keeping track of your sleep and your mood in this diary too, as both sleep and your emotions are proven beyond doubt now to be strongly associated with IBS symptoms, ups and downs. Number 4 is rebalancing gut flora with probiotics. Another huge factor in the development of IBS and keeping it perpetuating or going is the good bacteria or bugs in our gut are disrupted by an event like a gut infection or antibiotic use or even from a really bad diet. This causes the gut to get inflamed and the gut's special immune system not work properly, which in turn leads to the start of IBS. My own family member suffered for years with terrible IBS, and in medical school I started to get interested in IBS because of her struggles, and I recommended her after my research a specific type of probiotics, and within less than a month 90% of her symptoms just vanished. So after 30 years, she'd finally got relief from the bloating, the gas, and the tummy pain that she'd come to accept as just part of life. This is one of my first experiences with treating IBS, and it got me really excited to start helping other people with the same problem using non-drug approaches. Number 5 is get out of chronic stress mode, meaning that your nervous system, we have to get it out of fight or flight and back into what's called the relaxation response mode, also called in medical speak the parasympathetic nervous system. This is where you want your body most of the time, the parasympathetic nervous system. Chronic stress has a huge influence on IBS symptoms and on tummy upset, and most of us are walking around with sky-high levels of stress hormone that's affecting everything from digestion and mood to our energy levels, and we don't even know it. The good news is it's easy to bust out of this vicious cycle and stay that way using simple, highly effective relaxation techniques. Number 6 is retraining your brain-belly connection with things like hypnotherapy. Our brains are very connected to our body with real nerve connections and by chemical messages. There's actually a second brain that lives in our gut, believe it or not, and it responds to emotions, brain messages, our thoughts, and the things we put into our bodies. And this little brain in the gut controls how digestion works. By changing the messages from our big brain to the second brain in the gut, we can change the way digestion works and help eliminate problems with digestion, like what happens in IBS. One of the tools I use to do this is a specific type of evidence-based hypnotherapy. Number 7 is take IBS herbs. My top 2 proven herbs with loads of high-level evidence behind them to back them up with IBS treatment are something called enteric-coated peppermint oil, a specific type of peppermint oil useful for all IBS symptoms, but especially IBS pain and bloating. Second one is triphala. Triphala is an Indian Ayurvedic herb that has been proven to decrease IBS symptoms dramatically, especially constipation. I'll talk about both of these herbs in more detail and how to use them in a future video in this series. Drug companies, like Big Pharma as I call it, currently has almost a dozen pills marketed for IBS. But none of them are any good at getting rid of multiple symptoms without causing loads of side effects. Some of them bad side effects. Unfortunately, they're heavily marketed, especially to family doctors like me. And you won't hear much about the studies on IBS herbs and natural supplements that are a better way than these drugs, and it's proven in the research that they're better than the drugs because the drug companies don't want you to. They can't make money off of many of these herbal things because they're very inexpensive and also things that don't cost money. So, also conventional medicine training really neglects natural medicine pretty much entirely. So the chances are that your doc hasn't really heard of these natural things either unless they're very up to date on the IBS research literature, which most docs just don't have time to do with all of their patient care responsibilities. So there you have it. 7 easy steps to cure IBS without drugs. If this is the first time you've looked into treatment for your IBS, then you should be excited. You can now take control back over your life. You can feel normal again. What have been your experiences with IBS? And what have you tried doing for your IBS so far? I'd like to hear about your experiences as well. So please leave me a comment below and I'll try to talk about the most common ones that I hear back from you in the next video or a future video. And watch the rest of my IBS series, which will cover some of these steps in more detail. See you then.